Hi everyone, my name is Jed Murad. I'll be presenting on a topic which is Letermovir, which is a drug that prevents a virus known as CMV, which I will explain what that is in just a couple of seconds. So my topic originated because of my job, which is at Henry Ford Hospital as a research assistant in the transplant department, which is where I was introduced to the drug Letermovir and performed a few clinical trials, which I will also explain in this presentation. So CMV stands for cytomegalovirus and it's comparable to the flu. The symptoms are very similar in that people with CMV experience fever, chills, and headaches. However, CMV affects transplant patients much more drastically than it does in regular people. The reason for that being is because transplant patients have their immune system suppressed, which means they are more susceptible to viruses and things that aren't supposed to be in our body because the immune system is suppressed. So that's why pharmaceutical companies have been working on a drug, which is Letermovir, which is meant to prevent CMV. So how Letermovir works is it blocks an enzyme known as DNA polymerase. So DNA polymerase basically allows anything that binds to it, which is known as a substrate, to keep reproducing. So if the virus binded to DNA polymerase and the virus would keep reproducing and it would spread through the entire body. So when the Letermovir binds to the DNA polymerase, it prevents the CMV from binding to it and keep reproducing and spreading through the body. Additionally, the Letermovir fills subunits in our bodies instead of the virus filling our subunits in our body. So what that does is it doesn't allow the virus to encapsulate itself in our body and stay trapped there and transfer the virus from one organ or one subunit to the other. So clinical trials are being conducted now for the drug Letermovir. So the clinical trial is what is known as a double-blinded study. So a double-blinded study means that neither the patient nor the researcher knows what drug the patient is taking. So when they give them the bottles, they give them a label which says Letermovir or a placebo. So the placebo is just not the medication. It could be anything else, maybe just regular powder that doesn't have any purpose. Because they believe, so when they conduct double-blinded studies, they believe that if the patient knows the outcome or what medication they're taking, it may alter the results of the study, which is usually why they perform double-blinded studies. So this trial is a phase 3 trial, which is the last phase before it gets FDA approved. So if this final phase works out great, then it will be FDA approved and to be used for all other patients who suffer from the same thing. So currently there are over 550 patients enrolled in over 20 countries. The reason that's important is because patients in different countries all have different genes, race, ethnicities, and their bodies react way differently than if everyone was in the same population, which is why it's important for us to account for how Letermovir can affect the entire population and not just a specific type of population. So the results from the clinical trials shows the difference between the data between Letermovir and placebo. So of the patients that were taking Letermovir, it was found that 38% acquired the virus CMV, while the patients taking the placebo, only 61% acquired CMV. So this shows that Letermovir actually had the benefit with almost half of the patients acquiring CMV compared to the placebo. In addition, with any medication or transplant, something like this is very important. The death may occur. However, in Letermovir, the death rate was lower than the placebo, standing at 10% versus 15%, which is very important because death is definitely the most extreme side effect of the drug, which is why we hope that it's the lowest, whether it be with the study drug or the placebo, which is nothing. In addition, the side effects of Letermovir are very mild. It only causes side effects like nausea and vomiting, as opposed to the placebo, which can cause many negative effects on the liver and on the lungs, which can lead to to the damage of those organs as well. In conclusion, it's obvious that Letermovir has definitely benefited society, as it was always a struggle for pharmaceutical companies to find a drug that worked that prevented CMV and didn't cause any side effect or any major side effects that outweighed the benefits that it provided. So, Letermovir actually passed the phase 3 trial and is on its way to be FDA approved, which will be now used as the standard of care for patients as by the physician's discretion. If the physician decides to use it, he has the right to use it because then it would be FDA approved. And hopefully this will prevent many other patients from acquiring CMV and reduce the amount of rejections or negative effects that can happen to a patient's kidney. This is my reference of the article that I used to find my data, and that is the end of my presentation. Thank you for watching.